Hi everyone! So it's been a little while since I've made my last video, and I just wanted to do an update on how I'm doing and how I've been feeling after my craniocervical fusion and Chiari Decompression surgery about 2.5 months ago. Some of you have asked some questions about if certain symptoms have improved and whatnot, and I'm going to go over what is doing better and what isn't. And I do want to mention that I did have a wound infection at about 3.5 weeks post-op that resulted in another surgery and hospital stay that kind of delayed some of my progress. But I'm happy to report that in the last few weeks I've really made a lot of progress, and with the complications that I've had from this surgery, there were really some times where it was really tough to keep fighting, and I'm thankful to say that, you know, it's still hard, but it feels a little bit easier to keep fighting, to keep going. But I think sometimes when you're still feeling really sick, which I am, it's kind of easy to overlook the progress that you've made, and I just really can't deny that I'm doing better. I'm not doing well, I'm still sick, and I'm still really struggling, but I'm doing so much better than I was doing even just a couple of weeks ago, and it feels good to be able to say that. First of all, I'm gonna say I actually feel better than I did before my fusion. I've been able to do more things in the last few weeks than I probably would have been able to do before my fusion. Now, that being said, I still have a lot of pain and a lot of symptoms, and I'm not doing well, and I think that's why it really makes it hard to say I'm doing better, because I still feel really sick and I don't feel up to doing much, but I definitely feel up to doing more than I was even just a couple of weeks ago, and so that is a really big blessing. Okay, so first, my incision is doing a lot better. It is pretty much all closed up at this point, and so it's in a very low risk situation for opening up again, which is a good thing. My virus and thrush after getting the infection in my incision is all gone. Throat pain is gone. It's good. My walking has also improved. I am doing well with short distances. I'm totally fine to be walking around the house on my own, and nobody's worried about me falling or anything like that. So that is another really good thing. I'm not able to walk far. A block would really be pushing it, but short distances is good. As for POTS, I would say my POTS now and before surgery is about the same. And I've gotten this question a lot because I know sometimes with this surgery POTS can be improved, but sometimes it isn't. And so for me, my blood pooling, my heart rate, and POTS dizziness symptoms is all about the same at this point. And now that doesn't mean that it still couldn't improve. It could. My doctor said that my brainstem can take up to 2 years to heal, so the recovery process is going to be long, and I still don't know what other symptoms this surgery could help. My surgical pain is doing a lot better, and I would say that I'm in less pain now than I was before the surgery, which is good. But sometimes it's hard to be happy about that, because I still feel like I'm in a lot of pain, and a lot more pain than I should be in. But it's been better, and I definitely want to share that. So as for pressure headaches, I still always have a headache, but I would say that my headache isn't severe all the time. Before the surgery, it was difficult for me to function all the time. I always had a severe headache, and it just made everything really hard. And now I would say my headaches always get to a bad point at some point during the day, but I do go through periods where it isn't as severe, so I'm thankful for that. Right now my nausea has improved and my eating has improved. I still don't have like a great appetite, but I've been able to eat and keep things down, so that's another really good thing. My vertigo has improved, but it still has been happening. I'd say after surgery I've been having maybe like a couple of episodes of vertigo a week. And that being said, it's relatively like mild, like I'm not falling on my face, I guess. It's more like when I'm laying down and reading something, all of a sudden the room will start spinning and I'll just have to like stop reading and close my eyes for a while. My dystonia and neurogenic seizures, I've had some really good phases after surgery of actually not having any for like a week, and then I'll have flare-ups of those, and so it's really hard to tell where I'm at with those. But I would say overall they have improved, but like for example the last few days they've gotten worse for me, and so it's always hard when you have a symptom really improve and then it just comes back in full force, and it just feels really discouraging. But I hope that those will gradually improve more and more over time. Something else that has improved is that my ability to sit up for periods at a time, especially while I'm wearing my neck brace, has improved. If I have my neck brace on, I'm able to sit up for a lot longer than I was after my surgery and before my surgery. And so that has been really awesome. I have been weaning off of my neck brace, and so I've been taking it off more and more. And I would say about 1/3 of the time I'm not wearing the neck brace, and it is hard for me to like sit up for longer than like 10 or 15 minutes with it on. It really starts to hurt a lot after that point, but I'm trying to push myself reasonably with that so that I can build up strength in my neck and hopefully make it so my further instability below my fusion won't continue to get worse. And so that's the basic update. If you guys have any more questions about like other specific symptoms, then let me know and I'll do my best to answer them. But overall, I definitely am doing better, and I'm thankful for that. And actually in the last couple of weeks I've started up an Etsy store called Fused with Love, and I've been hand making awareness bracelets for different chronic illnesses, as well as making these cute little neck braces for little zebra stuffed animals for those that have craniocervical instability or neck injuries, neck conditions. And so that's been really fun for me. I honestly think it's been the first thing that I felt really excited about in a long time, and so it's just been fun to feel like I have more of a purpose and to be able to do things that can bring other people joy. And so I've really enjoyed doing that, and it's something that I can do more of when I feel up to it, and if I'm not feeling up to it, then I can take a break. So that for me has been really fun, and I'm excited to keep making more and more things for my little shop. So yeah, I'll put the link to that below if you want to check it out. These bracelets are actually some of the EDS ones that I've made, and so anyways, I just wanted to share with you guys that I have been doing a little bit better, and I actually just saw my surgeon this week, and everything from my fusion standpoint looks really good. I'm already starting to have some bone growth on my fusion, and all the hardware and everything looks perfect. My incision's doing okay. But this week I actually did have testing for tethered cord syndrome, and that was an MRI and urodynamic testing, and I did test positive for tethered cord syndrome. And so basically that means that my spinal cord is being tethered, and that injury to the spinal cord is causing a lot of weakness and pain in my lower back and legs, and it is causing something called a neurogenic bladder. And so if you've had urodynamic study testing, then you know that it is not a fun test to have, but sometimes you just gotta do it and get it over with. So anyways, my surgeon is recommending tethered cord release surgery for me, and it's not an emergency, but there is some urgency where he said, you know, I wouldn't wait 6 months to do it. Damage is being done, and the sooner the better. So we are gonna try to figure out when I can do that surgery, and we'll go from there. So it is discouraging, but my surgeon is really hopeful that I'll be able to walk and stand better after the surgery, and that's a good thing. So I am hoping that the surgery will make a big difference for me, but it also is just a little bit scary because it's another big neurosurgery, and I really don't want it to make things worse. So we still need to pray about it and like possibly get another opinion to make sure that it's the right decision. But that is the update from me. So I hope you guys are hanging in there, and I will look forward to seeing you next time.